everyone. This is Dr. Mike Chua, physical therapist and certified dementia practitioner. And thank you again for coming over and watching in our show, Misunderstanding Dementia show, and our podcast. And today we have a very, very special guest. Her name is Miss Katie Snider. She is actually the Assistant Director of Nursing in the Unity Psychiatric Hospital here in Martin, Tennessee. And we're here to ask her some questions, basically who she is, what does she do, where is she from, and what are the different services that the Unity Psychiatric Hospital offers for our community, not just here in Martin, but also in the Northwest Tennessee. So again, thank you very much, Miss Katie, for coming over. Appreciate you for joining our show, and we need more people like you educating our community, educating our people in our show. So thank you.
Thank you for having me.
Could you tell us where you're from? What do you do here? I know I introduced you, right? What do you do? And basically, what is Unity Psychiatric Hospital? So.
Yeah, so that's perfect. Well, I'm from Gleason. I went to school over here at the University of Tennessee at Martin, so that's where I got my nursing degree.
Go UT!
Yes, go
If you're
UTM.
watching and from your UTM, graduate of University of Tennessee, please comment University of Tennessee so she would at least see. So,
yes.
All right, go ahead.
Yes. So I've been here since I graduated nursing school. Started out working as a floor nurse, and then I just assumed the assistant director of nursing position in October of 2018. So,
oh, wow.
So I love working here at Unity Psychiatric Care. So a lot of people don't know exactly what we do. So we're a geriatric psychiatric hospital primarily, so we specialize in Alzheimer and dementia patients and trying to control their behaviors. So basically, if a patient, if they're either at home or if they're in a nursing home or assisted living facility, anywhere of that nature, and they have psychiatric symptoms that are severe enough to need an in-hospitalization, it could be just depression, or it could be if they're having behaviors that are hard to manage by the family. So they come here and they stay for a duration of time that ranges, it's approximately about 2 weeks. They get their medications straightened out, and they can return to an appropriate level of care for them. So we provide services regulating their medications. We have doctors and nurse practitioners that provide those services.
Oh, wow. So just for those people who are watching, there are different levels of care. You know, there's different levels of different levels of care. You've got nursing home, assisted living, independent living facilities, hospitals, rehab hospital, and there is a psych hospital. And just talk about the admission in psych hospital, and there are different qualifications, and she already mentioned it: Alzheimer's, dementia, depression, and they're basically here being taken care of, because sometimes in the regular acute hospital they're being discharged as early as 2 or 3 days, and they go home, and they still have issues with their behaviors and safety, and they're unsafe at home. So they can definitely come over here and being taken care of for another 2 more weeks. Nurses and doctors and physician and nurse practitioner taking care of their medication. That's what she was talking about. Because a lot of us, we don't know. All we know is just, okay, let's take mom to the hospital. Okay, let's take mom to the nursing home. And that's it. And let's face it, most of the nursing homes, they know how to handle Alzheimer's and dementia, but they have a hard time taking care of those behavioral problems, and this is where Psychiatric Unity Hospital comes in. So my question for you, Katie, I know I'm putting you on the spot, right? So you're taking care of their medication. What are the other services that you provide? I mean, do you have like a special room that you provide, like a sensory room, like Can you explain that to our audience?
Absolutely. So we have different amenities to the facility. One of them is a Serenity Room. So we have, it's a light fixture that looks like a cloud. You can turn it on or off if you want to increase or decrease the stimuli. We also have stars on the wall. It's just, it's lights basically just to provide some stimuli that's a little bit relaxing. We have aromatherapy that is offered. We have music therapy that can be offered in that room. We have all of our rooms. We've just renovated it. Last year we renovated it for our CARF accreditation, and we painted the doors so that they look more like apartments rather than institutionalized. So that's something that we try to integrate different things every year, and we try to just pull from a lot of different avenues just to try to make it the best possible fit for the patients, because a lot of patients it's intimidating to come somewhere, and we just want to make sure that they know that this is not a permanent stay. They're here for about 2 weeks, sometimes shorter or longer depending on how much medication changes that they actually need until they're stabilized, and then they're returned home. I've got this kite behind me, so
Yeah, actually, we're going to play some kite. You know, it's really nice and breezy out there. Just kidding. So tell us about the kite.
So the kite, the reason why I brought the kite in today is because part of what we do here is CPI training, or crisis prevention training. So what we do, any new employee that comes here, we train them, and this is actually part of the training. It's the verbal de-escalation continuum. So much like a kite bobs and weaves in the air, so do patients whenever they get agitated. Nobody follows a formulary of, they get agitated and then they yell and then they fight and then they start accusing and calm down. So like a kite bobs and weaves, a patient may be very sporadic. They may go up to the top, or they may start and you may see the build. So we teach different interventions of how to handle different things, different aspects of the kite, no matter where you're flying.
Oh, wow. That is such a great analogy. It's just, I think life is like a kite too. Sometimes you fly, sometimes you crash, sometimes that ties goes broken or whatever. English is not my first language, you know that. And all you need to do is just go with the flow. It's not how we control the wind. It's how we adjust with the wind and how we adjust the sail, just like sailing a boat. So thank you for pointing that out. And another thing that I really like what she taught about here in Unity Psychiatric is that she mentioned about that Serenity. Is it Serenity Room? It's like a Serenity Room wherein there is actually a cloud, not really a cloud, but a picture of a cloud, and there's aromatherapy. Why do you need that? When you're going to a facility, you have to look for a facility that is actually addressing different senses. Okay? When you have a dementia patient, Alzheimer's, whatever kind of dementia, whether it's an Alzheimer's, vascular, FTD, or frontotemporal, or whatever kind of dementia, you have to address all the senses. The touch, the smell, the seeing, the hearing. It's not just medication, because medication can only do so much. It can only control your hormones and everything, in your body, inside your body. But what you need to also facilitate and inhibit is the sense of smell, because sense of smell is actually very therapeutic. The vision, whatever you're seeing. Right now, I'm looking at a very beautiful woman here, and it's nice to look at. Imagine you go to a patient's room and you have a nurse that's not really, you know what I mean. It needs to have a very good, pleasant view. So that room that they have is a very pleasant view. They have this wall. There's this whatever do you have there?
We have the string of lights. We have the radio that we can implement in there. We have aromatherapy. So we can apply to our. Basically serve a lot of the senses. So you've got your smell and you've got your taste. Because we offer snacks. So it's visual, auditory stimulation, and also the aromatherapy.
There you go. And also we provide therapy here, physical therapy, wherein we provide simple therapeutic exercises, therapeutic activities, which is appropriate for their level, appropriate for their functional mobility, and appropriate for their cognitive levels. Because sometimes when you go to a therapy clinic or whatever therapy facility, all they do is put them in a bicycle, and most of the time they'll say, they're not participating. You have to find a therapist or find a facility wherein that therapist can actually work around with that patient and bring out that best in that patient, just like what Katie was talking about in this kite here. I mean, there's not a specific way to treat a dementia patient. You cannot just tell them, hey, let's do 10 sets of jumping jacks. You can't do that with a dementia patient. You need to learn how to adjust and fly with the kite. All right. So, anything else that we need to know here in Psychiatric Unity, Martin?
I think that's about it. If you feel like you could benefit from our services, please give us a call at 731-588-2830. Again, that's 731-588-2830. And if your family member needs physical therapy, along with the dementia care, we are lucky to have Dr. Michael Chua as our physical therapist, one of our physical therapists that come and serves the dementia community here.
All right. So do you have a website that we can check out for our
We do have
audience?
a Unity website that you can view. I believe that there's a Facebook page that they've got available too. But if you really are concerned or if you're interested, we have 24/7 nurses that are on staff here. So just give us a call at that number, and that way you'll have somebody a more personalized touch to be able to assess your needs.
All right. Again, thank you very much, Miss Katie. Appreciate you. Thank you very much, Miss Understanding Dementia. Appreciate you. And always remember the word FAST. F-A-S-T. F-A-S-T. Letter F. Find friends that will push you to your next level. Right now, I'm hanging out with Miss Katie. I'm hanging out with the awesome people here in Unity. So this is my average. You are the average of the 5 people you hang out with. So hang out with awesome people, okay? Letter A. What's the next letter? Letter A. You gotta learn how to take action. All this stuff that we're doing, these are all free services. It's not gonna do me good. It's not gonna do Miss Katie good if we don't take action on it. So take action. If you have a loved one that has Alzheimer's and dementia, they need medication management, reach out to Miss Katie, reach out to their website, and that way we can take care of you. What's the next letter? Letter S. Shoot. Keep shooting for the moon. Why? Because you're gonna eventually miss it. You know, you're gonna fail. When you're taking care of a dementia patient, when you're taking care of somebody with medical and cognitive issues, you're gonna fail. You're gonna fall. When you fall, when you fail, might as well fall and fail with somebody right beside you, like Unity Psychiatric, like Miss Katie here, like an awesome nurse here. Why? Because when you have somebody here beside you, they can lift you up. So keep shooting for the stars, because eventually you're gonna land with. Keep shooting for the moon, because eventually you're gonna be landing with the stars. Okay. And last but not the least, letter T. Not time out, but teach it. All the stuff that we're doing, we're teaching it to you. That way we can equip you with the right way to be the best caregiver that you can be. That's what Miss Katie's role here. She's teaching what you call CPI. I'm teaching the Certified Dementia Practitioner course. So it's all about teaching. Why? Because when you hear it, you forget. When you see it, you remember. But when you're actually teaching it, you're actually understanding it. So that's what Miss Katie's doing. So again, thank you very much, Miss Katie. Appreciate you. And any last parting wisdom for our audience?
Just if you have any needs, please feel free to reach out for us 24/7. Just always know that kindness is important whenever you're treating your family member, and compassion and empathy. So we can't always go exactly to where they are in their minds, but you just have to support them along the way.
All right. I love that. I love what you said. Kindness, compassion, and empathy. And that's what we need to have. All right. Be awesome, be great, be excellent. Thank you very much. And thank you, and you have a good day.
Thank you.